Hello and welcome everyone to another episode of Scott Schilling Speaks. I'm your host, Scott Schilling. Today, my guest is Miranda Clendening, and we're going to talk about some things that, quite frankly, I don't think a lot of people even know are going on. Miranda, thanks for being here today.
Yeah, thanks for having me. It's so good to be here with you, Scott.
Yeah, it's going to be fun because we got to get some information out to people. Now, would it be fair to say you live in rural America?
Yeah, very rural America. I live in Crestone, Colorado, a town of about 2,000 people. We have a lot of visitors in the summer, but not many that are here all the time.
Not many that stay there. Well, obviously, beautiful country, all of it is. But you by living in a town like that and being able to enjoy what you'd be able to enjoy from a nature standpoint and things, you suffer some things that people probably would never think about. You live in a town of 2,000, but you don't have a doctor.
Mm-hmm.
How's that work?
Not very well. For us and many rural communities, I actually grew up way out in the country in Texas before living in Colorado. And then in Colorado, I've lived in multiple mountain towns, which all have about the same situation usually. We here in my town, if we want to go to the doctor, we have to drive an hour, 15 minutes at minimum to go see a doctor in either Salida or Alamosa. And then those towns are so small that there's not really specialists. They have to send us 4 hours away to see a specialist. So needless to say, there's a lot of people kind of without good health care. I'm the only nurse. I've been a nurse for 20 years, and I'm the only nurse in our town. I help with home health care and hospice and getting people signed up for services with social services because they don't have much manpower through our social services either. We have a huge county that's not very, doesn't have much funding for human services because there's not a ton of tax dollars. So we've got problems in all those directions. Same with the dentist. There's no dental care here either. So we have to drive an hour and 15 minutes for dentists or orthodontists or doctors. So we've been looking for, obviously, is there any other solution? Is there a better solution? Is there something else that we can do besides just the driving? And a lot of people, when they get elderly here, end up actually having to move out of the community because of lack of being able to do that drive an hour and 15 minutes away as they're needing more and more medical care. And most people are not familiar with telemedicine or connected to it or offered it by their doctors or their healthcare systems. So they don't have that option that they know about either. And home care here is very spotty. I mean, every once in a while we have a patient, but we can't even offer like homemaker services or basic aid services because there's not enough people around to be a workforce.
So obviously, this isn't the only place in the United States that has this issue, but we need to call it out so that we can do some things about it. So you end up, I would guess, taking a lot of healthcare into your own hands and seeking and searching for. I was going to say new and better ways, but I would almost say any ways, right?
Yeah, I mean, in concentrated urban areas, there is a doctor for every 1 in 1,000 people usually, but out here or in rural areas, there's one doctor for every 2,390 people last time I looked. So that's one doctor handling a lot of people and their issues, and usually with a lot less staff. They're not connected to a big clinic where they get to have doctors to work together or anything like that. So everything is very stretched out here.
And you're saying also that there's no specialist per se, so it's just a
not at all.
general practitioner that's trying to cover every potential issue. I mean, that's got to be very tough. How does that affect the town or the people, or is it, I mean, are people rallying to try to do something about it, or they have just been forced to accept it?
I would say any community meeting and city meeting that we go to, if you ask people what is our biggest problem and issue here, they say lack of healthcare and lack of services for our elderly. And that means that as people age, they literally don't have a choice but to leave town, like I said, which is just it's a horrible situation to live somewhere for a lot of your life and then move just for the end of it away from friends and family just because you don't have care services. But even though at most of our community meetings, city meetings, county meetings, this being brought up is probably the number one issue, I don't see people knowing what to do about it necessarily. So that's why I've been working with Emergent Wellness and Tim Hobbs and trying to work on a different solution, which I actually think is a very amazing and great solution that is getting a really good response here. And we're about to open a physical clinic to go along with the online program that they offer.
So is that, why don't you expand on the progress you've made with that whole process?
Yeah, so I'll just explain a little bit. Tim and I have known each other a long time, 15 years even, I think. And we've talked about this issue a lot. He comes from a world of data systems, especially like healthcare data systems and how we aggregate data, how we share words between healthcare practitioners, but still keep things HIPAA compliant, and has a lot of expertise in that kind of thing. But even though he has expertise in that, he rarely sees a system that is actually bringing together people's medical records into a system that doctors can get a more well-rounded view of what's going on with patients, or have patients be able to kind of lay out their own healthcare plan more by knowing what's going on with them. So they have Emergent Wellness, emergentwellness.com. Anyone can go and see it right now, but and even sign up on there as a patient, as a practitioner. There's community interest groups and everything going on as well. But it puts healthcare into your own hands, where you get to say the biggest things that you can go through whole systems assessments. You can get a health concierge that can help you look at your health holistically. Sometimes those are nurses, sometimes those are medical assistants, sometimes even life coaches, or somebody just if you're looking at, quality of life, or you're looking at different things besides healthcare that you're wanting to look into, stress or economic situations or housing, you'll be sent to different areas. But the idea on there is to have a lot of practitioners available, as many that patients need, that they can get access to and have a full range of it online. And a lot of times you still will need to see one of these doctors in person somehow at some point to establish your doctor-patient relationship, especially if you have insurance that's needing to bill, you have to have an in-person visit. But we're finding more and more doctors that are actually willing to go make visits to remote areas or rural areas that don't have care and do that initial visit. And just go there once a month or something like that, and make a whole web of doctors doing that. And then the rest of it is done through telemedicine, which has gotten pretty incredible now. I mean, a lot of places are going to telemedicine. Medicare, Medicaid covers a lot of this. There's nurses with an iPad. Lots of times they're taking your vital signs, they're looking at a wound, they're doing a full assessment, then they can get the doctor on the iPad or the video call, or send pictures and vital signs and metrics, and talk to the doctor, and then get you a prescription, get you a diagnosis that you need, get you a referral to a specialist, or whatever it is that you're needing, without any lapse in time. Like, you're not having to wait 2 weeks for an appointment. You're not having to drive an hour and a half or 4 hours in our case to go see a specialist. That you just have access to them through telemedicine and through clinics that have multiple doctors just coming sometimes, that can mostly see you online. And then the technology system does a lot for really continuing to ask you about your whole systems assessment. How is your life going? How are you feeling? How are your energy levels? What problems are you having that are different than last time you talked to your doctor? What do we need to know and what do we need to talk to the doctor about? So the technology really helps to bypass a lot of what doctors spend so much time with you face to face, and then a lot of times don't even have time to ask you. Most of them, a lot of times, aren't even doing a whole systems assessment. They're coming in, they're giving you 5 minutes to tell them what's wrong with you right now, or what do you need, or what do you think you need, but they're not really doing the comprehensive assessments like what we're able to do on emergent wellness and with healthcare concierge type people to really ask, are all the parts of your life being taken care of and the way that you want them to be? And if not, how do we help that?
So in your local area, are there alternative healers available, or is that in short supply as well?
No, actually, in my area, there are a lot. Crestone's kind of a weird community where 30,000 people actually visit us in the summer for health retreats, health and wellness retreats, and spiritual retreats. We have 25 spiritual centers here, and 84, last time I checked, 84 alternative wellness practitioners in a database here that you could contact for anything from Reiki to yoga to massage, herbalists, people that will, take you up in the mountains to learn how to pick your own herbs, all kinds of stuff like that, aromatherapy, all of that. But they're not in a database that that people can find. So we're creating an emergent wellness hub here to where people can have access to a doctor that comes here every once in a while, so they don't have to leave town to see them. Then they have access to that doctor all the time through telemedicine and the nurses that work with that doctor. Their health concierge through holistic assessments. And then there's also the local database of all 84 of the practitioners that are right here in our area, that then if their doctor says, well, you're dealing with chronic pain, some things that help with that is, going to the hot springs, getting a massage, doing some of these different things. So then they can look on there and see what resources they have locally for that. It is up to the community to create a community hub and put in all of those resources, and then practitioners can go in themselves and add to the hub once it's created. But yeah, it gives people access, infinitely more access to the knowledge and who the people are and this whole system more than what they had before.
Well, it seems as if it's a very progressive way to approach the lack of MDs overall, period, right? We as a country are suffering from not enough trained doctors to begin with, but then the trained doctors are in the metropolitan areas and not out in the rural areas. So it seems like actually a very progressive way of addressing individual health.
Yep.
In a more holistic fashion.
Absolutely. And it's not just rural areas either. That's just my experience and pitch on it, because that we need it so badly. But we have groups in Dallas, Texas and Boulder that we're working on, that there's plenty of doctors around in the regular healthcare system, but we're experimenting with privatized healthcare to where you can pay your doctor $150, $200 a month for private insurance to have access to this doctor. Some of them may even do house calls. Some of them are available 24 hours a day. You can actually be texting your doctor or calling them, or the nurse that works with them, and have access to a doctor that's kind of your own doctor, and they have their own network, and they're not answering to insurance. They're answering to you paying that monthly payment and having access to what they say you have access to with them. And we're finding a lot of people, even in big cities, that have access to their regular healthcare with insurance that they're coming from, that hasn't been taking care of them like they want. They don't want to be shuffled in like like a guinea pig, just in a line, go see your doctor as quickly as you can, and we're just going to give you the basics of what you need, and you don't even know or trust whether that's the right thing or not. So especially a lot of naturopaths and DOs, or people that really spend a lot of time with their patients and tailor a lot of the therapies, are looking at this more privatized healthcare system. And there's still part of the money that you put in each month goes towards a fund that takes care of you if you have to have a bigger thing happen in the hospital, surgery or emergency care, that kind of thing too. So you still have all the same things that your insurance would be providing, but usually paying less, especially than something like if you don't have a company that's helping pay for it. And we're also talking a lot to companies as well, that some companies are paying like $1,000 a month per employee that they have just to cover their healthcare and dental and everything, and not even knowing what that's covering. Does it even cover preventative care? Does it cover things that are alternative therapies, stress relief, massage, any of this other kind of stuff that could really be helping people thrive and have quality of life more, but they just don't have access to it. So a lot of corporations are looking at privatized healthcare systems as well, and going to that kind of thing now that doctors are participating in it, and big, databases like this that can hold the information and help create the network to help you find the services that you need in even better ways than you can right now.
Well, I think it's fairly evident, anybody who's been in corporate medicine, meaning going to a hospital or a doctor's office that's part of a big corporate group, it tends to be run on, okay, you've got 6 minutes to get this accomplished. Well, what can you get done in 6 minutes? You can't even really say hi, much less, evaluate and go through and do things like this. So it makes a tremendous amount of sense to, number one, include the alternative practitioners, whether that be massage therapy, physical therapy, acupuncture, shamans, whatever, right? Because we know that the vast majority of, or not the vast majority, all disease is created by one of the three stresses: emotional, chemical, or physical stress. And the alternative practitioners certainly have their own way of dealing with their portion of that. So it makes a lot of sense to put this together, and that emergent wellness could be the model that really carries this through around. So how do we get this groundswell up? Do we have to educate the masses first? What's our plan of attack here? What do we need to do?
Yeah. We do mostly, I think, gain the trust of people and, shift a mindset and a consciousness through education and support. And so here in our community, we've been doing meetings once every other month that are like, what do you think you know about healthcare versus what could be in healthcare here?
That's a great
and
topic there.
Yeah, and what do you want? What do you want to see? And everybody that then gets educated on what we don't have, which they already pretty much know, and then looking at what is this like as a solution if we were to continue to cultivate this, to have an emergent wellness hub, one physically, and have everybody interconnected in the virtual hub as much as possible, which doesn't mean, I have a lot of people say, but I don't do technology. I'm not a computer whiz. I can't, I don't want to I can't do something that's complicated. You say I got to get on my video phone with my doctor at my house or have video visits, all of that. As a community, you have to make that easy for people. You still have to have a hub where they can come and be working with someone that is good with computers. The nurses are good with video calls, iPads that do video and all of that, and they can still do their visit with you there locally and not have the computer issues get in the way. So that's where the healthcare concierge or nurses that work in the program help with that piece of it. But a lot of that can be done in a community seminar or workshop, using the first bit of it to present about what we're wanting to build, where we want to go, and then spending the rest of it having a few hours of intakes to where some health people are helping guide people getting into the system. Anyone can go in emergentwellness.com right now and sign up in the system for free for the initial part of it, where you're just saying, what do I what do I want to look at? And you can look at all the different sectors, body, mind, spirit. I'm needing help to find a specialist. I want to know about alternative therapies. I want to join a community interest group about CBD or whatever it is. All of that is on there already. And then it becomes very tailored after you start to put that stuff in of what you're asking for. You get led down pathways to get what you need. And we're just experimenting with what it looks like to do it as an entire community and a community hub. So that'll be coming more and more, but anybody can go ahead and do a filling it out on their own as a patient or a practitioner, or have a community event where they're talking about this and then have people sign up from the event in the system and start getting services.
I know a lot of times in talks, I ask the question by a show of hands, how many of you don't know what you don't know?
I think that's all of us.
Well, exactly. And I think that's one of the biggest things with this healthcare issue is, one of the things is there's insurance, but then there are these alternative health plans coming into place where it's really people getting together and designing a better way of doing it. They're seeing, novel things, even having the ability to make a cash payment on a surgery, or negotiate a cash payment prior to the surgery to bring the costs down, and all these different things. And so again, I think it's an important place that it is all these, I kind of follow in business, I follow Richard Branson's concept of entrepreneurialism. Identify a crowded market, find the problems in the leader in that crowded market, provide solutions to those problems, re-enter the market. I really feel that's a lot of what emergent wellness is doing, is really following Branson's entrepreneurial theory of, look at what's going, look at who's doing well, look at what could be better, make it better, and then come in there, right? And so I think that's a lot of what emergent wellness is, and what you're talking about here with, again, looking at the alternative practitioners. I mean, I had a 40-year bias against chiropractic. Of course, I had never been to one. I just listened to what somebody had said. And then when I finally went to one, and after the third adjustment, the pain that I had had for an extended period of time was gone and stayed gone. It was like, well, maybe I should have a different opinion of this, right? You don't know what you don't know until you know it. And so again, I think that that's a lot of what you're doing here. How can we help you get the word out where you are and get the word out elsewhere?
Well, I think share this video, share Tim's video, which is more an explanation of emergent wellness. This is more an explanation of how it helps rural communities, or how we help introduce it to our communities. But also anyone that sees this, that's interested, just contact us through emergentwellness.com. Get in touch with us and ask for resources for sharing it with your community. We'd be happy to pass that to you and kind of show you how you can use the website as a guiding education thing, so that people can go and sign up right afterwards if they're interested in this kind of thing. And then we're growing, so we're open to any suggestions. I mean, if you want to know more about the privatized healthcare, how can I hook up with a doctor that I have to pay $150, $200 a month, and I have access to all these services, because you have access to your doctor and then all the alternative practitioners that are on the site as well. If you want to know information about any of us, just contact us through the site. You can go through the assessments on the site. You can have access to your own healthcare concierge, which will help you work through knowing what you don't know. I mean, if you're in there saying I have chronic pain that no doctor has ever helped me with, they keep giving me these pills that don't help, what are they not telling me? Our healthcare concierge, have a lot of mapping and charting of well, you should look into these other alternative therapies. Massage can help, hot and cold therapy, all these other things that you might not have ever looked into because your doctor either doesn't have time to tell everybody everything that's out there, or they're not aware other than what they do. It's not necessarily their job to talk about alternative therapies. Sometimes it's more their job to issue prescriptions and do that kind of stuff that they're taught. So letting people that are experts in those other alternative therapies actually talk to you and teach you about how it can help you, and figuring out a plan for how you actually find the right person to help you is what we specialize in doing.
Well, I think the one thing that we haven't really touched on, and I think it makes a lot of sense. The only thing that heals the body is the body, or the only thing that heals the body is the power that built the body. Either one of those two, they're both accurate statements. But what we haven't talked about is preventative care, and coverage like that is one of the ways that we could help our sick care system, is to not get sick in the first place. So how do we get more of that out?
Yeah, so that's part of what our
preventative
whole
part.
systems, that's part of what our whole systems assessments are about. They're about thriving and wellness. They're not about sick care. We do address the things that, if you're marking on there, things that show up in red, which are, I have a lot of pain, or I'm tired all the time, or things that are really detrimental in your life that are symptoms that we need to take care of. We do address those, but the whole rest of it is about things that you should be doing to keep your body in its normal state of being, to where you're going to be in good health and wellness. So we ask about nutrition, we ask about stress, we even ask about relationships and your emotional health, mind over matter, what you think creates what happens in your body. So are you happy with what's going on with your thoughts and positivity and lack of stress, or are you having a lot of emotional pain and stress in your life, or emotional or relationship stress, all these different things that a lot of times nurses and doctors don't have time to ask, or they're not asking, and they're just generally not using a whole systems assessment for wellness and for true thriving and prevention. But once we get through this assessment, if you're saying, no, I don't take vitamins, I eat only processed foods, and I'm not eating foods that are healthy for me, and my relationships are all stressful, and I'm feeling emotional all the time, and I'm tired all the time, then we have a lot of things to address just to get you into health and well-being. But some simple things in your life can help that a lot about learning about emotional intelligence and communication and stress relief, or making a habit or a pattern for yourself of 3 times a week, I'm going to go to the hot springs or do self-care with massage, or something that reduces my stress and tension, so that I can not have this build up and have all these other health side effects. So we address that a lot. And this system gives a way to address that without making your doctor have to do it every time you visit, but you're in charge of more of your healthcare, or with your healthcare concierge that's meeting with you and then asking the questions, filling out the surveys, and going with the recommendations that we find in there on what you might not know about yet.
Sounds like a plan to me. Sounds like we need to get this out and make sure everybody knows that they can go to emergentwellness.com and find a plethora of great information. Miranda, thank you for being here today. Thank you for sharing the information. And any last words of wisdom for everybody?
Not really. I'm sure I'll see you again in the future, and we'll give updates on how things are going and how local hubs are starting to emerge. And feel free to contact us anytime. As I said, there's a contact us button on the emergentwellness.com website. And it's free for anybody to just go through there, fill out your information, get curious about what you might want to know with Mind, Body, and Spirit on there, or the community interest groups, and just reach out to us and get involved.
I think you said something very key there. Get curious. It's your body. I mean, I don't think many people are. I think that's actually a great tip to end on there. Thank you for being here with us, and all of you, thanks for being here. We'll see you again, same time tomorrow. God bless.
Okay, thank you.